numbers from the CDC show a surge of sexually transmitted infections in the United States with no signs of slowing. In 2021, there were 2.5 million cases of chlamydia, gonorrhea, and syphilis. The most significant rise was in syphilis and congenital syphilis, which occurs when mothers with the infection pass it along to their babies during pregnancy. From 2020 to 2021, cases of each went up 32%. Ali Rogin has more on this concerning trend.
Over the past decade, there's been about an 8-fold increase in the cases of congenital syphilis in the United States. In 2012, the numbers were at historic lows thanks to robust contact tracing and public health efforts. But infections have gone up every year since. And syphilis in babies is much more serious than in adults, carrying a risk of stillbirth and long-term health problems. Here to talk about what can be done to address this is Dr. Irene Stafford. She's an OBGYN and maternal fetal medicine specialist at UT Health Houston. Dr. Stafford, thank you so much for joining us. Let's talk first about why STIs in general are on the rise in the United States.
So thank you again so much for having me. The rise in STIs in this country is multifactorial. Part of it is inconsistent screening patterns, especially with people that are in special risk groups. Unfortunately, our emphasis should be placed on offering and encouraging routine screening for STI in every health encounter. Sexual health in general really seems to be underemphasized due to a lack of screening and unfortunately other significant issues such as access to care, funding, lack of available clinics. All of these factors contribute to the rising rates of STI.
And then how about congenital syphilis in particular? Is that part of the overall increase in STIs that we're seeing?
As a matter of fact, there's been over a 30% increase in all cases of syphilis infection, and particularly perinatal syphilis, where a mother who is infected with syphilis can pass it to her baby. We've seen over a 30% increase in congenital syphilis cases in the last several years.
And things were going so well. As we mentioned, in 2012, cases were at a historic low, and now they've increased. So how did things go so wrong?
I believe that partially we are not being vigilant about screening and treating pregnant women. Unfortunately, according to the CDC data, about 30% of women don't have access to care. On top of that, there's been a certain percentage that have actually been screened for syphilis but did not get timely treatment. And lastly, there's been a surge in cases where women have converted and become infected with syphilis during the third trimester.
And if it's not, what are the symptoms? What are the consequences of not treating congenital syphilis?
Well, unfortunately, the infection itself during pregnancy carries a 30 to 40% perinatal loss rate. And if the baby does survive during the pregnancy and is born with congenital syphilis, sadly, the baby will be in the neonatal intensive care unit for over a week, in some cases longer. The baby can have blood problems, liver problems, bone problems, and probably one of the biggest consequences is when the infection itself affects the central nervous system or the brain of the newborn, and that can lead to neurosyphilis, which is quite detrimental and hard on a newborn baby and the family, of course.
So you're seeing these patients every day. Once somebody comes in for treatment for a syphilis diagnosis, what does that look like?
My responsibility, and I think the responsibility of most health providers, is actually to counsel the patient, talk to her about the need for treatment. Oftentimes with syphilis, especially when it's been there for a long time, that level of infection and stage of infection requires multiple doses of penicillin. So the counseling component is critical to help patients understand the need for continued surveillance and follow-up so that we can treat her adequately for her stage of infection.
And what about the role of COVID-19? We saw lots of resources being reallocated to account for COVID. Was congenital syphilis part of that reallocation of resources?
Absolutely. We did everything we could to reduce contact for patients, to reduce the spread of COVID-19. But unfortunately, that sort of alienated a lot of patients. Their favorite clinic on the corner of, say, Broad and Fifth closed. They didn't know where they could go. So those kind of changes in the actual structure of healthcare really impacted STI screening, especially for infections like syphilis that can often be asymptomatic. Not all patients have complaints. It can be a rash that people think might be eczema and so forth. So oftentimes they don't bring that to the physician's attention, and definitely not when they're not face to face with a physician.
So what can people be doing to protect themselves from getting and transmitting congenital syphilis?
Well, I think to begin with, physicians, providers, everyone out there needs to actually start prioritizing sexual health. I mean, this is a call to action. The CDC just came out with a statement that it is time for us to use every resource we can to help encourage patients, regardless of risk factors, to get screened and treated for STI. In addition, patients need to self-advocate, and if they're, at the physician's office, go ahead and talk about sexual health with your provider, especially when you're pregnant, if you're concerned about syphilis infection. Use protection. We've seen in the data that people are using condoms, unfortunately, less and less to protect themselves from STI.
Dr. Irene Stafford with UT Health Houston, thank you so much for your time.
Thank you for having me.
Good morning. Today is Monday. It is April 24th. The year is 2023. I'm sitting here in the living room. You guys have probably never seen this room before, but this is the formal living room. It's on the front of the house. I'm sitting in here because I have the ladies who clean my house are here cleaning all the windows on the house. So all the windows are getting a good scrubbing today. They need to be cleaned. The windows were cleaned last year, but this we're only cleaning them again. It's been a year, so once a year you should have all your windows cleaned in your house. Because houses require maintenance and work, and if you don't clean the windows, there'll be dust and bugs. And so we put cleaning the windows, and we're putting the screens on the windows because it's springtime. And although this morning it's free, I had to turn the heat on this morning. It was cold in this damn house this morning. I said, "Fuck that shit! I turned that heat on." Why are that news article, the news report you just saw, the problem, they didn't go into much detail about race in that video, but this is a black problem. These are black babies being born with this genital, these diseases. These are black people who are passing these diseases around. The vast majority of these diseases are being spread by unprotected sex, no use of condoms in the black community. And they didn't really go into any detail of that. And that's the part that kind of struck me, because if you do any research, you'll see this is an African American problem. Well, I'm not exactly sure why black people have decided not to use condoms and protect themselves when having sex, especially when you have multiple sexual partners and you don't really know your sexual partners and you don't know their history and you don't know what's going on with them. If you are having sex with somebody, and you have to be able to trust that person. If you're having unprotected sex with somebody, you better at least know that individual and trust them they won't bring a disease into your home. But because so many African Americans are getting these diseases and they're obviously not getting tested, it's funny because every time I go to my doctor, which is every couple of months, to have my blood pressure medicines checked, I also use testosterone. They check my labs for my liver, my kidneys. That's why I need to call them. I think I have an appointment coming up. I know I have an appointment coming up sometime right after my birthday. But anyway, I'll call them in a few minutes. Every time I go to my doctor's office, I'm here in Atlanta, my doctor has a very strict rule. Doesn't matter if you're married, gay, black, white, young, or old, they test for all STDs. Everybody that walks through that door is getting tested. No ands, ifs, or buts about it. Everyone. That is his policy. And at first, I'm not surprised by it. You're dealing with a lot of active people. He's a sports medicine doctor. They deal with people who are in fitness, and They deal with all types of people, but they have, this particular office has a strict rule about testing everyone for STDs, HIV, syphilis, gonorrhea. They make you pee in the cup, swab this, do everything you throw every time. And they just say, and they explain it to you, they read little things that at this office, there's a term for this. And they check everyone. And if you're going to a doctor, and if you're walking in and out of doctors' offices, and they're not testing you for STDs, and you're not going to get tested separately, you have to, if you're sexually active, you have to get tested for everything, not just HIV, but you have to get tested for syphilis, gonorrhea, HPV. You have to check in your throat, your anal area, they swab these areas, make you pee in a cup. I forget what the P is for. They're checking for all this, for me, the various different types of STD. I'm very lucky. I wouldn't even say lucky. I'm 53 years of age and I've never had an STD in my child. I've never had syphilis, gonorrhea, any of this stuff. I just was not randomly running around having sex with a bunch of people. I know shit happens. I know people do get STDs, and if you're having sex, you're going to get a sexually transmitted disease. I've had some situations happen. I thought I had something. I went and got tested, and there was nothing going on. You don't have anything. So, my suggestion, this could be avoided. If you're sexually active, you must get tested frequently. The testing really costs nothing if you have health insurance. I don't pay anything for that testing when I go to my doctor's office. The testing they do pull blood and they swab your throat and various sexual organs. It's not painful. I'm not sure why people are not getting tested for STDs, and these STDs are exploding in the black community in particular. They didn't even go into that because y'all black folks get offended. Oh yeah, they coming after us. They making this up. I've seen so much stuff about people who just have a very difficult time understanding what's happening within the black communities. Y'all, all you gotta do is go on Twitter. And you take a look at it, there's another element to this. Not only are these black people, but particularly black, bisexual, and gay men. See, the black community, we have a tough time understanding that there are a lot of bisexual men out there. And I've said this in the past, people get upset at me. But there are two spectrums, three different spectrums. You have gay men, which I fall into that perspective on the spectrum. You have gay men, bisexual men, straight men. I fall into the gay men section. I'm totally gay, I'm not bisexual at all. And you have straight men who are totally straight, they're not bisexual. But in the middle there, you have a large group of bisexual men there. They outnumber gay and straight men. In various forms of sexual activity, you might have a gay man, a bisexual man, who might just enjoy oral sex. He might just like a man giving him oral sex, or he might just like to participate in oral sex. Still a risk for STD there. When you have a large group of bisexual men, because syphilis is a disease that even if you use a condom, you still can spread syphilis. So a lot of people get offended by this. You got straight folks who get offended because they have a hard time believing that there are just a lot of bisexual people out there in that spectrum. Gay people get upset because you're attacking them for being gay and bisexual and spreading diseases around. The reason why these diseases are spread because they have so many sexual partners. It's not about being gay or bisexual or straight or black or white. It's just your sexual partners. Having so many sexual partners and not getting tested in between these sexual partners. So if you're a person who's having, within a week, and I'll be conservative with this, some people are having maybe 3, 4, or 5 different sexual partners within a week. Some people have that many in a day. Some people literally might have 1, 2, or 3 sexual partners in one day. One day. That's a lot of sex, right? And a lot of people are doing this. So if you're jumping from sexual partner to sexual partner to sexual partner and you're not getting tested, there's no way you can get tested. It's almost impossible for you to get tested that frequently within a few days of that. I mean, you'd have to get tested every day. And maybe the testing might be inaccurate if you get tested. But just the bottom line is you have a lot of people out there participating in a lot of risky sexual behavior, not using condoms, having multiple sexual partners. That's why so many of these diseases are untreatable now. And they're difficult to treat with current medications and antibiotic medications. So, I had a friend, never forget this, he contracted in his anal, his asshole, he contracted a untreatable form of gonorrhea or syphilis or something in that area. And they had tried to give him various different ways. They had to literally hospitalize that man, hook him up to an IV. And for some reason, I don't know why, I can't remember, he ended up having to have some type of surgery on his asshole, on his rectum. That's the correct word. I'm trying to be civilized over his early morning. And he was in the hospital. They literally had a tube draining the mucus or whatever after he had surgery. It was a tube they had attached to in a pump because he was having these issues in the hospital. So they had to hook him up to an IV to try to antibiotics intravenously to get rid of this issue that he was having. And my friend, he just told me about it. He was in the hospital. Nobody was coming to visit him. He'd been in there. He was up there for 2 weeks. So, something like that. And he called me one day. He said, I'm in the hospital. I'm having this problem. He just told me, so I went to go visit him. And when I got up there, I was like, okay, what? I to see what was going on, but you really can't see. Then he explained to me. And this was not, the problem that this particular person is probably one of the most attractive guys here in Atlanta. Worked out in the gym. Beautiful body, healthy from the outside. Physically looks well. Mentally looks well. But was having a lot of unprotected sexual, unprotected sex with these individuals. Now, when I was there, he admitted to me he was HIV positive and had been for years. So I said, okay. So that presented another issue because if you're HIV positive, are living with HIV, which would be the correct term to use, I find those guys tend to be a little bit more reckless than other folks. So because of that, because they feel like they already got HIV, I guess, I don't really know. They tend to participate in a lot more riskier sexual behavior. Go on Twitter, you see all this stuff. I go on Twitter, and I see these guys, and some of these guys I know, and some of them are my clients, but I go on Twitter and I see these individuals having so much unprotected sex that is unreal. They don't have a care in the world. Multiple sex partners. Daily. You know they're getting STDs because there's no way around it. Because if you're having this with the sexual partners and you're recording this and filming this, they're getting some STDs. There's just no way around that one. Let's just keep it real. They don't care about the risk. But then this goes back to the bisexual men and women who have sex with these bisexual men. Some women may not know that the man that they're dating or they're having sex with is bisexual. I mean, the black community is so sexually driven today, it just don't make no damn sense having sex these people go around here. I like sex just as much as the next person. Like, God damn. And can't you just fuck one person? No, they gotta fuck 10,000 people. And that's where problems come in because they have so many sexual partners. And when you have that many sexual partners, How can you even keep track of who you're fucking and what they got and who got what and who gave you what? You can't. It's impossible. And then you're not getting tested. I have some friends and associates who have not been tested for STDs in years. And they'll tell you they're scared. I think I want to know if I had something going on with me and that's why the doctor that I go to, that's why they check everybody. It is mandatory. And all doctors should do that. All doctors should do that. They should test everybody that walks through that damn door. In fact, if the United States really wanted to control this type of behavior, mandatory, they could come up with, as you apply for a job, you have to go get mandatory tested for STDs. If you apply for any type of government assistance, if they really wanted to control and keep this stuff in check, that's the whole question. Do they really, want to keep these things under control and keep the virus and keep these STDs, these sexually transmitted diseases from being passed around? There are things they could put in place that will force people to get tested in treatment. That's what it boils down to. But we seem to be going backwards here in the United States when it comes to STDs. So many people don't want to wear condoms for whatever reasons. So many people don't want to participate in youth protected sex. So many people having so many different sexual partners, complete strangers that they meet online, hook up. They don't know the person. They don't even know the person's name. They probably could point the person out in the lineup 2 hours later. They didn't identify the person. So if you have that many people participating in sex like that here in Atlanta, that's how they live their lives. And I'm sure it's in every other city, because every time I mention Atlanta, they do it everywhere. I said, yeah, I can imagine they do it everywhere. Well, I ain't worried about it, because I ain't running around there fucking like that. So I've never had an STD in my entire life. I plan on keeping it that way. But like I said, people do live their lives the way they live. You can't tell these people nothing. I'm gonna post this video, I'm gonna post a news article. People gonna naysay it, and I can't wait to hear what people have to say. Bottom line is, if you are sexually active, you must get tested frequently. And if you have an STD, you need to get treated for it. But you'll never know if you got it or not if you're not getting tested. And clearly these people who are spreading all these STDs around are not getting tested. And that's what it boils down to. And some people have a sexually transmitted disease and they don't know because there are no symptoms. So if you don't know you got it, you won't know you're spreading it around, right? So, it's a small little video. I know it's a Monday morning. This is such a hard subject to take on a Monday. Give me some more hot coffee. Excuse me, I'm spilling coffee. But anyway, I'm over here, my windows clean. And you're gonna be all day. There's a lot of windows in this damn house. They gave me a good price too. They probably like shit. We gave them the wrong. But yeah, they're scrubbing these windows clean. They're literally scrubbing them. They should be clean. Windows should be clean once or twice a year for the price that they gave me. I'll do it again in a few months. But anyway, I'm looking at the rug in here. I need to come in and vacuum this rug in here. I don't know what is this stuff. I'm going to get that vacuum. But anyway, today it is Monday, April 24th, the year 2023. If you are sexually active, it is essential and important that you get tested frequently. We have a couple places here in Atlanta where you can go get tested for free. They test for everything. You can run my ass over there to get it. I'm thinking about getting back on PrEP. I want the injectable version of PrEP. In fact, I'm going to run my ass. Well, I can go to my doctor and get it too. So I'm going to call my doctor today. I want to get back on. I want to at least try the injectable version of PrEP, just to see what it's like. I know it's available. Because I have to do to protect myself out there, especially as I moving forward and me and Earl begin to go our separate ways. I have to do what I have to do to protect me. Today is Monday. It is April 24th, the year 2023. I look forward to reading you all's comments and about this particular video. I'm going to get some more coffee and go back and enjoy this beautiful Monday. April's almost over. Monday, April 24th, the year 2023. I'm out.